Hello everyone, my name is Dr. Chinwe Akuonu and I'm a dentist based in London. Today I would like to talk about the most common questions and doubts that I receive as a dentist, both from my patients and also from questions sort of coming online. The first one I'd like to talk about is the question concerning whitening. We live in a day and age where everyone's looking to get that perfect smile. We see it on social media, everywhere. I think especially after COVID, people just had more time to sort of focus on their appearance, especially on their teeth, their smiles. They were all online, Zoom meetings, etc. And we found that after the pandemic, we've had sort of this boom in terms of cosmetic dentistry. So one of the most common questions that we get is, how do I get my teeth whiter, and do whitening toothpaste work? I think we're all familiar with the fact that when we go to the supermarket, we see loads and brands of toothpaste that brand themselves as whitening toothpaste. Just to let you know, from a professional point of view, most of these toothpastes they do tend to help brighten the teeth, brighten the smile, but generally speaking, they will not whiten the teeth. They're able to sort of remove those superficial external stains, but not able to penetrate into the teeth and remove more of those permanent stains. It's also very, very important to pay attention to the kind of whitening toothpaste that you are looking to get or you're buying. It's very important they do have fluoride. Fluoride is a very important mineral that helps strengthen the teeth. And another thing that you need to check is that these toothpastes are not abrasive. Unfortunately, most of them are. We have a term called RDA, which means relative dentin abrasivity. Unfortunately, this value is not always sort of available, for you to check on the toothpaste for you to know how abrasive a toothpaste is or not. So my recommendation is generally to sort of not saying you can't use a whitening toothpaste, but as I've said, to get that sort of bright, true whitening effect, you need to definitely see a dental professional. The problem is then that we do see online, apart from whitening toothpaste, we see people using different methods. I've heard about bicarbonate, lemon, charcoal, all these things. These are all abrasive ingredients, and what they do is, in the short term, they can sort of give you the illusion that your teeth are getting whiter, but in the long term, you actually end up with yellow teeth. And the reason is because the enamel, the outermost part of the tooth, is just being sort of abraded, over a long period of time by those abrasive materials, hence leaving the teeth yellow in the long term. So as I've said, if you're ever interested in whitening your teeth, please speak to your dentist. People ask as well too if it's safe. It's absolutely safe if it's being, prescribed and monitored by a dental professional. For you to be able to whiten your teeth, you need what we call peroxide, be it carbamide peroxide or hydrogen peroxide. And it's very important that these substances are being administered under the correct dose, with the correct dose, because if it's too much, it can cause damage to your teeth. So it needs to be, as I've said, monitored and supervised by a dental professional. These substances are able to penetrate into the outermost layer of the tooth and break those internal areas of staining. So as a dental professional, my advice is, if you're ever interested in whitening your teeth, please speak to a dental professional, your dentist, your hygienist, seek their advice, and they will be able to prescribe the best kind of whitening for you, what kind of peroxide, how many days, the percentage, etc. And they will be able to guarantee you the best results.